Well, good afternoon. First of all, thank you for giving me the opportunity of being here. As you already know, let me check if it works like this. Perfect. So you all know that long COVID affects around 5% of individuals post an acute COVID infection with persistent debilitating symptoms. It produces an impairment in quality of life, daily functioning and work capacity, creating socio-economic challenges for healthcare and societies. As you already know, currently there is no targeted or effective therapy available for PCC, highlighting a critical need for novel treatment approaches. I think in this context, as Dr. Salmon has said before, therapeutic plasma exchange has been proposed as a treatment for this condition. In this context, TPE could mitigate PCC symptoms by cleaning pro-inflammatory mediators, cytokines, autoantibodies, and other pathogenic factors from circulation. It's been demonstrated its efficacy in immune-mediated disorders and severe COVID cases, suggesting a potential therapeutic role in PCC. But despite promising anecdotal reports, there is a lack of robust clinical evidence. You have seen that right now there are rigorous evaluation of TPE safety and efficacy in PCC through different randomized placebo-controlled trials. So based on this, we designed a phase 2 double-blind placebo-controlled randomized trial, a single-center study conducted at German's Strassi Pujol University Hospital, in which 50 patients with PCC with a severe impairment of the functional status through the PCFS scale 3 and 4, they were allocated in two groups, the experimental group and the control group. The experimental group that received therapeutic plasma exchange with 5% albumin, and the placebo group in which an infusion of 250 milliliters of saline solution was administered. Some of you will be thinking how these people could manage to perform the blinding measures in this group. So we used music to mask machine sounds for both groups. We also used an opaque tubing covering all the circuit from the patient to the machine, and a curtain separating the patient, the participant, from the machine. All the patients and participants receive six sessions of TPE or sham TPE over 3 weeks, Monday and Wednesday or Tuesday and Thursday. After that, there were 3 follow-up visits until day 90. Our primary endpoint was related to safety. We wanted to evaluate the safety and tolerability of TPE in patients with PCC compared to placebo. Our secondary endpoints were more related to efficacy. Exploring changes in the functional status, we have said that all the patients had a severe impairment in the functional status. We also explored changes in PCC symptoms through the Canruti post-COVID condition symptom scale that you saw yesterday from Dr. Mateo. Changes in fatigue, changes in neurocognitive status also with specific scales. To finish, we also explored longitudinal evaluation of biochemistry, hematology, coagulation, and inflammation blood biomarkers. So our inclusion criteria were adults, more than 18 years old, with a prior SARS-CoV-2 infection, confirmed by PCR, RAT, or serology, at least 90 days prior. PCC symptoms persisting after 90 days from the acute infection that lasted for at least 2 months and that couldn't be explained by other diagnosis. Reduced ability to perform daily activities, we have said, PCFS scale grades 3 or 4, the maximum, and an adequate peripheral venous access for a proper intervention. The exclusion criteria were a recent SARS-CoV-2 infection, less than 90 days, or a recent vaccine dose. Also comorbidities making the infusion of 250 milliliters unsafe, or pregnant, lactating individuals, or also contraindications to plasma exchange. Other exclusion criteria were planned current hospitalization or participation in other clinical trials, or the inability to provide informed consent. What we saw in our study, we had a group of patients, most of them were women, in their late 40s. As you can see here, more than 50% in both of the groups were on a sick leave before starting the intervention. From those that were working, more than 25% had also a reduced schedule related to long COVID. Related to the most prevalent pathologies that participants were suffering before the intervention, you can see here that allergy was the most frequently said. No? Related to safety, to our primary endpoint, from all the adverse events that were reported during the intervention, you can see here that there were no serious adverse events reported during the study. All of the adverse events were mild or moderate. You can see that there is only one severe adverse event that was reported in the plasma exchange group, but was just an impairment in the fatigue that the patient was suffering before the intervention. Related to the most commonly adverse events reported during the study, you can see here that most of the adverse events were related to general disorders, and also disorders or problems in the administration site for the intervention. Related to our secondary endpoint, to efficacy, when checking the scales to explore the functional status and also the quality of life, you can see here that there were no differences between the two groups. In plasma exchange group and placebo group, there were no differences in the evolution of the scales between the first day of the intervention until the last day of the follow-up. When checking the evolution of neurocognitive assessment through different scales that were specific for this, like the NeoScreen, the semantic fluency test, and the HATS, you could see that there were no differences between the two groups in the evolution of patients related to the neurocognitive assessment. So there were no changes in the placebo group, neither in the plasma exchange group. Talking about the laboratory parameters, we try to study the evolution of different parameters related to hematological, biochemistry, or coagulation. As you can see here in all these graphics, there were no differences in all the blood tests that were performed to patients during the study. There were no changes in their values in any of the blood parameters. So, as conclusions, PCC, is a complex, long-lasting, and a highly disabling disease, which has no specific treatment to date. This is the first randomized clinical trial evaluating or trying to evaluate TP in subjects with PCC. Our findings reflected that TP was not effective in improving symptoms, functional status, or quality of life of patients. There were no longitudinal changes or differences in any of the analytical parameters evaluated either. Also, in accordance with previous studies, TP was a safe procedure. There were also in subjects with PCC, as no cases of severe anemia or disbalances, electrolyte disbalances, or any other procedural symptoms were reported. To finish, this clinical trial had some limitations, like the small, simple sample size, single-center study. Also, the time elapsed from the acute infection to plasmapheresis, the specific method that we used for plasmapheresis, and also the possibility of a mismatch between the speed of production and clearance of the target pathogens that wanted to be evaluated, and the number and frequency of TPE sessions. And as acknowledgements, first, thanks to all of you for being here. Also, thank you to all the team that is being behind this study, because it wouldn't be possible to have got these results. Just like a representation, thanks to all the people that are nowadays trying to look for different ways of treating this illness. Thank you.